I'm giving you all.
Hello, ma'am. I can
Good
share.
afternoon, ma'am. Good afternoon.
Yes, we'll take the beginning slides and then I'll ask you all to share.
Okay, sure.
Why I told you this homework? Because rack your brains. When we start, you should come up with not repetition, something different, okay, from the other person. So welcome everybody to this 3 p.m. Wednesday afternoon. It's a class on understanding sinusitis. It is part 2, but we are going to refresh the part 1 also, okay. So this is my favorite slide. Knowledge is power, information is ammunition, and awareness is enlightenment. The ancient maxim, know thyself, applies to every facet of human existence, especially to one's health. The prevention, treatment, and management of illness and disease becomes easier and more effective when we are aware of the early symptoms of a medical condition, how to recognize those symptoms, and then how to go about getting the right kind of treatment. By this, I request you all that even though you all have learned a lot in these camps since 3 years, you should not take the tool of self-diagnosis, self-management, self-treatment in your hands. You should be consulting a doctor, maybe consult even an MD doctor, a senior doctor. Ask him what's wrong. But your job after these camps is to take your disease in the initial stages so that you can nip it in the bud stage and not allow it to become like a big catastrophe, like a snowball effect, and it becomes the last stage of the disease when it gets very fearful to hear that from the doctor. Okay, so pick up your diseases early. It's friendly to the pocket, it's friendly to your energy, it's friendly to your resources. Everything is done quick if we go initially. So yesterday we understood that what exactly is sinusitis. Itis is the word here, and it's caused by inflammation of the cavities around the nasal passages. Triggers can be a simple cold or some allergens or infections or growths. Okay, we spoke about adenoids also yesterday, and we will be differentiated about acute and chronic sinusitis. Come on, now tell me what do you all remember from yesterday's class? Yes,
Yeah,
Manish.
yeah. Good evening. Good afternoon, doctor. The thing which you told about steam inhalation.
Beautiful.
Yeah, that Bombay people should not take steam inhalation, and I tried it yesterday evening. Tawa rakha gas pe, and I took a cloth and I gave fermentation to myself, and I really felt better. Otherwise, I was feeling very heavy. I don't get headache, but heaviness is always there. So that has reduced a bit. So I'm happy. Thank you.
Thank you. And these tips are something which I give to I'm a homeopath. So
Yeah.
I give my patients in private practice.
Yeah.
So it's okay. It's okay. Knowledge comes from somewhere and everything comes. It's a universe. So I share very abundantly. You get all right, you bless me. It's that way.
Thank you.
Yes, come on, Radha madam.
Just we talked about the what is sinusitis,
Hmm.
then sign and symptoms, what are the causes,
Hmm.
and then a little bit of like this um, inhalation, different kinds of. Me too. I never knew about the hot fermentation for instead of nasal, inhalation. Usual that hot water one, boiled
Yes,
water, steam.
yes, yes. So there is a testimonial that madam is feeling better already.
Mm.
Okay, what else besides this? Come on, all causes, then you must name some causes. If you said symptoms, you must name some symptoms.
Viral, it can be bacterial,
Yes,
fungi,
beautiful,
and
very nice.
irritant, nasal polyps,
Yes,
and
today we are going to learn about nasal polyps. Excellent. What else do you remember? Come on, Tasneem Pitalwala
respiratory,
was also there.
respiratory infection
Dehydration.
also can cause,
Respiratory infections can cause. Yes,
and
Tanra Singh, you
low
were also there.
immunity.
Allergy.
Allergies, yes. Come on, Lakshmi madam.
Dehydration.
Yes, dehydration also we learned. Foreign objects, yes. We spoke of some people, even if the fly is there or something, it can create a lot of fungus around it and all. What else was there? Carol, why are you so quiet?
It's not
Pollutants,
good to use
pollutants.
the net. Don't use the neti pot.
No,
Use your
I'm not able
hand.
to fathom. Huh?
Use your hand to do the
Nasal,
nasal,
use your hand. Excellent. Come on now,
not the
because she
neti
said
pot.
this example, you all get to grow on that. Come on, grow on that. Take hints from what she spoke about Jalniti. Okay, she's saying that the hand is beneficial than the pot. And come on, I got a hint from what Carol shared. Nobody? Lakshmi madam, you don't remember anything?
Yeah. If you take like this, it touches all the inside, nostril inside. But if the nasal this, it goes straight away to that. It won't touch.
Yeah, but that is the point which Carol raised. Something new point. New point. Then I take it. Very important point you all are forgetting. Come on, Nikki Masala, you came at the end of the class. That time I shared that.
Refrigerated things, eating, drinking.
Can you repeat, madam, the question? I
What
try
do you
and
remember
answer.
from yesterday's class?
I
You
remember.
entered last, no? What do you remember? I was sharing something important.
What all the type of sinuses I understood. Balance was not well.
Yes, sinuses.
Should put
Come
little
on, this
salt,
is Dalwala.
salt in the water. Nasal.
That is Jalneti only. Some new point, Lakshmi madam.
Steam inhalation.
वो हो गया, उन्होंने शेयर किया. मंजुषा मैडम को अच्छा लगा, उन्होंने ट्राई भी किया and she is better also. What else? Something very important you all are missing out. It's really important to understand that. Come on, tick tick 1, tick tick 2.
Some face yoga.
Breathing.
Yes, elaborate breathing. It's on that which I'm talking of.
Pranayam.
Then Butko breathing.
Buteyko breathing, okay. What else? Buteyko breathing, yes. Yes, Sachin Tikkalwala. We differentiated between nasal breathing and mouth breathing. Bhul gaya? Forgot?
Yeah.
Yeah. And then which is beneficial because of what? Which is beneficial because of that main thing which you are forgetting. Ruby madam.
The diaphragm.
Diaphragm. It affects the
Diaphragm
diaphragm.
is used. Yes.
Nasal breathing helps
But
to.
one major thing you all are forgetting. Come on, Suman, you were also there yesterday. What points did
Diaphragm touches the lower part of the lungs.
Madam, we know what is the diaphragm. Next point. Okay, benefits of nasal breathing. I'm giving you all hints.
Abdominal breathing.
And if madam, speak if you're really short about the answer. Benefits of nasal breathing. Kaun
To
bolega?
clear the nasal passage of the infection or what?
Are Nikki, you entered late, you will not know.
Nasal breathing helps in purifying the air, warming up the air.
Nitric acid.
Yes, Lakshmi madam. Not nitric acid.
Nitric.
Nitric acid will
Nitric
burn the nose.
oxide.
No. What is that? What do you call that?
Okay, I give it to you. It's nitric oxide.
Nitric oxide.
Which is the magical gas, magical molecule. It is a vasodilator. So when you breathe through your nose, nasal
I remember. I told you I got to know
mute,
from your
madam,
class.
mute. Lakshmi madam, mute.
Sorry.
Mute, because you're talking with me. Then the others can't hear. Thank you for that. So when we tap nasal nitric oxide, our body's blood vessels become larger. The blood supply increases. Now you can also get a difference in the measurement of your blood pressure by stimulating nitric oxide. So Manjusha madam, you didn't attend the diabetic camp. 3 weeks, 2 weeks back, we had a camp on diabetes wherein I taught a dump exercise, which is very good. Nitric oxide dump exercise, which is very good. And when you do that, it helps in diabetes. It also helps in the levels of the blood pressure becoming normalized. Why? Because you get more blood supply. And that exercise has to be done thrice in a day to keep your levels of glucose in check. And when we breathe through the nose, I explained to you all, this lower portion is more sensitive, right? The wings of the nose have different epithelium or different skin, and the lower part has different skin which is more sensitive. It is known as erectile tissue. That's why the smell also goes and hits on it. We also spoke about the smells in COVID. When the smell reduces, what you should be doing? What is that?
Taking zinc.
Zinc. Very good. So zinc, yes, yes. So zinc is the vitamin which is needed for repairing your olfactory passages. Okay, clear? Come. Now let us quickly run through the slides. This was what we did. Anybody else who remembers something, you can unmute and tell. You will remember eventually as we proceed. So I'll just quickly take these slides because I need to cover up yesterday. So chronic sinusitis, yes, we spoke a lot about histamine. So no remedy working, tired of popping in antihistamines. What are histamines? So the mast cells in your body, when there is some allergy, when there is some irritant, okay, what do? The mast cells produce histamine. And what does this Sinarest and Setzyme do? It quickly suppresses that level of histamine. But once the effect of that medicine is gone, you will require a second dose. And what do those medicines cause? They cause a lot of sleepiness, sedation, right? So it's a good idea to be having a lot of fluids. So I tell my patients, have a lot of kokum sharbat because that's cooling. Okay, have it, make it freshly home. I'm south, the coastal people must be knowing how to make it at home with kokum, because otherwise a lot of sugar is there in the ready-made syrups. Okay, so it should be a little bit sour, khatta meeta kind of thing. That also helps in flushing out the histamine from your body. Have a lot of limbu pani, lemon water. It helps in flushing out. Understand, if there is an irritant, you should be flushing it out from your body, not that you take a pill for every ill. I am not the doctor who takes a pill for every ill. It's the worst thing to be doing. So if you go to the doctor and you tell him one symptom, he writes one medicine. You tell him one more symptom, he writes one more medicine. Because otherwise he's a bad doctor, no? If he tells you to change your lifestyle. That is too tedious a task to change your lifestyle. So it's better to pop a pill, no? It's easy, no? And no doctor has the time to sit and counsel you. Are, what is the reason that you are getting this cold? What is the reason? Is there a maintaining cause? What is the meaning of a maintaining cause? You are doing something which is keeping the disease intact. Now that day, I read about avocados. Passion? Everybody eats avocados? I don't eat.
So, so expensive.
Lakshmi madam is
No.
50 plus. I cannot eat. I have not tasted an avocado. I don't like to taste anything new. The foreign vegetables. I'm happy. I've not even tasted the capsicums. That day somebody told me the red and the yellow capsicums don't cause belching and burps. Only the green one causes. So I put it in the salad. I cannot accept new things. So it's a fashion, no? Avocado toast. Fashion. Very expensive. So it was written, if you're, yes, in the ending. See, Naki Masalia, you could have spoken about that. Nice Tasneem Pitalwala, that we spoke about unnecessary vaccines. I like her prefix or an adjective, unnecessary. Hello, Nirupama Sharma, newcomer, welcome to our class. Hope you enjoy this 1 hour ride with us. So we were speaking of avocado toast. So now everybody has nice, expensive avocado toast. But do you know, if you have too much of histamine in your body, you should not have. So what does that avocado become? Suman, Nini Gogia. That avocado, Carol, what does that avocado become to your disease?
Say it again. What does the avocado become?
I'm asking you, in your disease progress,
Uh huh.
avocado become? You have cold. I told you that you should not be having avocado because people have high histamine levels, so avocado is not good.
So that means it is increasing our histamine level.
The maintaining cause of your disease. Obviously, it will increase. It is the maintaining cause of your disease. But you didn't know only. You didn't know. Bekhabri mein maza hai. So, as a good doctor, you have to sit and counsel the patient and ask, what do you eat? Then you will realize this is the maintaining cause. Meena ji, आप समझ रहे हो मैं क्या बोल रही हूँ? What is the maintaining cause of the disease? You don't know only it's bad for you and you're having it. Like my skin specialist friend, she is from Sion Hospital. I'm from Mumbai. So she says she used to live in Dadar and she always jokes that skin specialists do not have good skin. Always they will be having something. Okay. So she has real, what to say, I don't like to call them holes, but she has these not even marks, they are quite deep. So she says that the doctor, my mother used to go and tell the doctor, my daughter is eating so well. Pock marks, excellent. They are pock marks, smallpox kind of marks, but smallpox has been eradicated now. So she says, my mother used to go and tell the doctor, my daughter is eating so healthy. She's having milk 2, 3 times in a day, all dairy products so well. She eats healthy, and still she's getting these pimples. Why? And now, when she has turned vegan, okay, when she has turned vegan, everything has gone, but she has those pock marks. So that time we didn't know that dairy causes skin allergies. Samjha? So I always remember this. She's elder to me also, but she says my mother used to tell the doctor, and now I realize that milk was causing it. And when she stopped it, it vanished. So these are known as maintaining causes of your disease. And it's not that you have to blame yourself, you have to educate yourself. What is that first slide? Knowledge is power, information is ammunition, awareness is enlightenment. Then if after awareness also you want to eat, then please go ahead and eat. Spoil your life. Okay? But they say no, once bitten, twice shy. You've learned it once, learn that you shouldn't be doing it. Till then you didn't know about it, right? So this is usually self-diagnosable. Lab tests, a simple X-ray will tell you if your sinuses are full. We also spoke about the symptoms: headache, facial pain, runny nose, nasal congestion. Acute sinusitis usually does not require any treatment rather than beyond symptomatic relief with pain medication, nasal decongestants. And yesterday we also spoke of what is the best way to open up your clogged nose, your blocked nose, rather than using sprays.
Nasal drops, saline nasal drops.
Saline nasal drops. Okay, so you can prepare them at home, sterilize the water, little bit of salt, cool it, put it into a nice plastic bottle so that it does not break into your nose while you're putting. Be safe, and then one drop, and then lie down, and your nose opens up. That's why your Jalniti also has saline water. Okay, why do you think it has saline water? Is because all our discharges are salty in nature. Have you ever tasted your blood? It has metallic color, metallic taste. The blood has metallic taste. Your tears, I'm sure we've all cried in our lives, and I'm sure they must have gone to our mouth. Our tears also are salty. Hmm? All the discharges are. That is to maintain their. I do not know what language to use, but that's the way they are. They are salty. So we introduce a little bit of salt. And chronic sinusitis may get the gut flora good enough. Just a minute. Yeah, and rhino we also discussed. The rhinoceros is called so because rhino means nose, and it leads to upper respiratory tract infections in children. Yeah, this is what we discussed yesterday. And recently, what is chronic sinusitis? How do you define it? It's that persistent symptoms for 8 weeks or 4 episodes in a year. That means you're suffering from chronic sinusitis. Each episode lasting for more than 10 days. There are hypertrophic changes in the mucosa. It may follow an acute attack if not properly treated, or maybe slow in this origin. So, a person of suffering from sinusitis may suffer from thick. We spoke about hypertrophy. The nasal mucosa becomes very thick nasal mucosa, plugged nose, facial pain, fever, headaches, a poor sense of smell, a sore throat, and cough. Smell decreases because the nerve is affected. And symptoms, again, this is, yes, a repeat slide. This is the way a doctor will check on you. She will apply a little bit of pressure, clear, a pressure on your face, and if they are tender, that means you are suffering from sinusitis. Yesterday we differentiated the places of the sinuses. So here is the frontal sinus, then we have the ethmoid sinus, and behind the ethmoid sinus we have the sphenoid sinuses. There are 4 sinuses, and then this is the maxillary sinus. Okay, now this side is the healthy one, this side is the purulent one or the inflamed one. Okay, greenish color, yellow color is the pus. Similar like this, see, ethmoid sinus is here, and sphenoid is a little up, ethmoid is a little lower. This is the nasal septum, which we are going to study today about DNS or deviated nasal septum. That's your maxillary sinus. Excess mucus means sinus infection and inflamed sinus lining. So what are the 5 signs of inflammation? Anybody remembers 5 signs of inflammation? All of you all are awake.
Reddishness,
Redness. And what else?
swelling,
Okay.
little bit,
Swelling,
on palpation.
Pain,
pain, swelling,
Redness,
pain, swelling.
swelling,
puffiness, hot. I
thick.
mean,
This is
Hot,
pain.
hot it will be. Warm.
There is
be
heat.
warm.
There is color, rubor. Rubor is red. Dollar is pain. Color, rubor, dollar. And edema. Why edema? Otherwise, you will keep using that part. If it will be swollen, it's like a cocoon. It's saving that inside. And the last one is loss of function. Why loss of function? You can't
Because of
do activity.
pain, swelling,
Yes.
No smell.
Acute and chronic.
Acute and chronic. So healthy sinusitis and like this. So this is the same explanation, sinusitis, and now it's known as rhinosinusitis. It's inflammation of the mucous membrane that lines the sinuses. Again, these are the similar kind of symptoms: plugged nose, fever, headache, nasal mucus. Acute and up to 4 weeks. Subacute is 1 to 3 months, and chronic is more than 3 months. Paranasal means the sinuses are around the nose, air spaces around the nose, they get inflamed. Now, according to the area also, we can quickly understand which kind of sinus is affected. So if you're having a lot of pain in the forehead, that means it's your frontal sinus which is affected in the forehead pain. If you're having pain in between the eyes, that means your ethmoid sinus is affected. And pain behind the eyes, tearing, splitting, headaches in the forehead. Okay. Maxillary is behind the cheeks and pain over the cheeks. Sphenoid is a little lower, we just learned. So deep behind the ethmoid sinus, and pain in front and back of the head because it's behind, behind the ethmoid. So these are the quick ways of understanding. How does this? What are the stages of sinusitis? First, there's a clear sinus with air, making breathing easy and comfortable. Then sinus pathways becomes enlarged and swollen, making you feel stuffy. Sinus is blocked and fill the fluid, making breathing difficult as well as uncomfortable. This is the third stage. When the pus sets in. We also learned about the bacteria, the streptococcal bacteria, which infiltrate and give rise to that greenish yellow pus kind of color. So, what is this? The causes of sinusitis can be various, viral, bacterial. So, this is what Radha Madam said, fungal, allergic, and can be after nasal polyps, can be dehydration. One of you all did mention, I'm so happy, dehydration, and medications. And these are the different kind of causes. Again, bacteria, pollutants, fungi, respiratory infection, polyps, fracture of the sinuses. Suppose you have some injury. Foreign bodies, one of you all mentioned, Tasneem Madam mentioned. Low immunity and smoking.
Smoking.
Yes. So sinusitis, how do we differentiate it from allergies? So symptoms can be in sinusitis, sinus pain, stuffy nose. We have spoken to about it quite a few times. Warning signs, stuffy nose and cough lasting longer than 1 to 2 weeks. Duration is acute sinusitis lasts less than 4 weeks. Chronic sinusitis lasts 3 months or longer. What are the symptoms? Runny, stuffy nose, sneezing, wheezing, and watery eyes, itching eyes. Warning time begins shortly after the exposure to an allergen. Duration, once the exposure is taken away, it subsides. So that is an allergy. So seasonal, yeah, this is okay. Nasal, I spoke about it. Seasonal allergic rhinitis is more common in cities than in villages, definitely because of the pollution by the vehicles, by the ACs, by the whatever the urbanization is giving us a lot of issues. Allergic rhinitis is a multi-factor disease with genetics as well as environmental factors influencing disease development. Okay, so yes, this is something very important to understand. What are logged plugged ears? Have you all seen this? Have you all seen what happens when your ears are plugged? You can't hear, no? When does that happen?
Cold.
When you are cold.
When you are in a flight.
Hmm.
When we go to high ranges,
What did Nisha Hatish say?
when we go to high ranges like Munnar,
Yes, Munar and all. Also, quickly, as you all said, when you are in a flight, when it's taking off and you're up in the air because of the difference in the temperatures. So, how do you think we can be opening up those plugged ears? So, there is something known as Valsalva's maneuver. I will tell you Valsalva's maneuver. Hydrogen peroxide can be used, or we can be using simple ear drops. Then, air travel and the sinuses. Patients who fly notice that the pressure changes in the cabin during flight can bring about discomfort in the sinuses or also in the middle ear. This occurs because reduction in pressure during ascent and descent causes a corresponding increase in the cranial pressure in your head. In patients with acute or chronic sinusitis, this blocks the sinuses, the eustachian tubes, leading to pain. Patients who complain of this problem might be asked to use nasal decongestant or short-term basis to see if they get any benefit. Okay, now your body naturally maintains a normal balance of air pressure on both the sides of your eardrum. When the pressure changes between the middle ear and the outside, you will feel like the ears are plugged. Depending on the amount of pressure change, you may even experience pain associated with the changes. What is the meaning of this? Let's keep it again. Understood? So it depends on the variability of the change in the pressure. Okay. Otherwise, the body maintains a normal balance on both the sides of your eardrum. Now, how to pop up these ears? So one is you can. What is this? Can anybody see? What he's trying to tell you?
swallow,
Yes. And the next one?
Yawn.
yawn.
Yes. Very good. And the third one?
OTC dangers.
Over the counter.
Over the counter, ticket.
Okay. Then he's telling you to chew gum.
Hmm.
And then what he's telling you? Suck on.
Suck on hard candy.
Very good. Suck on hard candy. That can also see. I also didn't know all these. I make slides for you all. Then when I'm teaching you all, I remember. When I made them some years back, I remembered. Now, what exactly is Valsalva's maneuver? Okay. So see what she's doing. She's closing her mouth. So, the Valsava maneuver, in which a person tries to exhale forcibly with a closed glottis. What is the glottis? The windpipe. Okay, so that no air comes out through the mouth or through the nose. The renowned Italian atomist, pathologist, physician, and surgeon Antonia Maria Valsalva, who first described the maneuver. So, what is the meaning of this? Can anybody explain to me? And how the ears will be popping off? Read it once more. Explain.
Ujjayi,
Yes.
Ma'am, air
Ujjayi pranayam.
escapes through your ear and it opens your
Air will not escape through your ears. You want to read it
Escape
again?
through the mouth.
Mouth is closed.
Air
With the
pressure,
nose.
air
Mouth,
pressure
mouth and
on the
nose closed.
sinuses.
Mouth and nose are closed.
Mouth and nose close or forcefully throw the air.
Forcefully.
That's why forcefully exhale the air.
So you
So कान में प्रेशर आता है और वो ये हो जाता है, खुला हो जाता है.
खुला हो जाता है.
मैं यूज करती हूँ ये टेक्निक.
अरे, okay. So what she's trying to say is that you close your nose, close your mouth, and try to exhale. What is this? Glottis also closed. And once when you do that, the ears will open up.
Ma'am, that is what I was trying to say. Ke air escapes through ear because in gut section I always face this and I follow this method.
Okay. Okay. So it is this great man, this scientist, this surgeon, whatever, Valsalva. So it's named according to Valsalva's maneuver. Okay, now again let us understand it. Now it can be also used to get water out of your ear. What do you mean by get water out of your ear?
While swimming,
Drown,
has entered.
When? What else?
the
Not
person drowns in the water.
huh?
The person drowns.
Not everybody drowns. Not everybody swims. Give me a common example.
Everyday bathing.
Bathing, not every day. Hair wash. Hair wash.
Yes.
Every day doesn't go. Okay. So why we should be using it is because what do we do when we come out after the hair bath? What do you all do? And I'll tell you what I do.
We shake our
मैम
head.
कान में उंगली डाल के उसको जरा घुमाते हैं.
Earbud.
Earbud. And do you know earbud can cause so much of infection in your ears because earbuds are going to push the wax more inside.
It creates, moreover, it creates dryness. Divya, I'm suffering for the past 4 days. The ear, there is a dryness in my ears, paining because of
Create infections also.
earbuds.
Earbud create infections also.
We should not put earbuds because we don't know how to push them. Actually, the right way is going up and then getting it out. That's why the ENT has a forceps which has a loop. Even the people on the road who remove wax, no, outside gardens, they sit on that fence and remove. They also have one
When we
arrow.
were kids, they used to remove like that only in the village. The
No, no.
village side they have usually.
Just like a spoon, they are having a little spoon.
No, it's not a spoon. It's just a loop inside. A
Type of a thing.
So they go up, they go ahead and they get it outside. We cannot be doing it ourselves. So now, after today's class, you all are scared that you should not use the earbud. Then how do we get the water out? One is Valsava's maneuver, and the other way is what you must be doing. Never, you can be putting a finger and this side, just shake and it will come off. Okay, that's a good idea. The ENT has explained this to me, and depends on which finger you want to use this. But some people feel that this finger can go inside, it's too small and thin. So you can be just bending a little down and allow the water to escape.
Sometimes we put more water and fill it. Do like this, it comes out everything.
No, you should
No,
not put
should
more.
not do. Okay.
Lakshmi madam, you will pay market tax.
Very bad. Thank you for telling.
So you know what Lakshmi madam is talking of? So in my house also, when they are getting gas or something, no, they'll say, let me have a soda. And then what they'll do after having that soda, they'll burp and they'll feel nice. But actually it is that soda only carbon dioxide which is coming out. Nothing is happening to your abdomen, your gas. It's there only. So when you are happy, you're putting so much water and so much water is coming out, means that only water is coming out.
No, entire will be out. That's what I mean.
Should not put water in your ears.
Okay.
Not even put oil in your ears. If the
हाइड्रोजन पेरोक्साइड
वो सब नहीं करने का, because झाग आता है, वो भी नहीं
So
करने
much
No,
of
no, peroxide.
that only we have to put.
all under the supervision of a doctor. So let us quickly understand how Valsava's maneuver gets water out of your ear. Close your mouth, pinch your nostrils, close with your fingers, and then take a deep breath. Okay? Gently blow air out of your nose while keeping the nostrils closed. See, this is another way. Close your mouth, pinch your nostrils, close with your fingers, and take a deep breath. And keeping the nostril closed, blow air through your gently blow air out of your nose while keeping the nostrils closed. See, again it will pop. Done correctly, you will hear a slight pop, which means the eustachian tubes are open again. Same thing. Let us understand what exactly is the deviated nasal septum. So ideally, this is the normal nasal septum. It is in a straight line and both the wings of the nose are equally open, equally patent. What happens in a deviated nasal septum? It's, see this. Little bit of deviation, little bit of C-shaped thing occurs. And do you think, does it count? Is it so important? So what if it's a little crooked? No. It's very, very important to understand that it is a major cause of a person sneezing, a major cause of person getting colds and coughs repeatedly.
Snoring also is caused by this.
Because of deviated snoring is because the tongue is so big and heavy that when you're lying, it goes and chokes your upper palate, the tongue. Snoring is a different effect, different story. Person can snore with adenoids. Nisha Ratish, when the adenoids, the lymphoid tissue get inflamed, the person can snore. Now, allergies. So these are again the reasons. Asthma. See now, yesterday we also understood about asthma. Last week, this is a normal bronchiole. In asthma, it gets inflamed, there gets edema, and the skeletal muscle becomes zigzag, means it becomes contracted. So this is inflamed bronchi. And pollution can also be leading to sinusitis. What is the meaning of weak immunity? What is the meaning of weak immunity? So these are known as immunosuppressed people. So some people who are very, very senile, okay, they have less of movement. Even some children, they get repeated colds, means they are having weak immunity. So good way is, trying to build up their immunity through exercise. Through blowing, what is, I have explained to them. So the newcomers may not know the cheapest exercise. Okay. Now newcomers answer. What do you think can be the cheapest exercise? So Radha madam is smiling. She knows the answer. Lakshmi madam, you're not unmuting yourself. I have a gun out here. You're not unmuting yourself. Okay. No, I told you not to unmute yourself, Lakshmi madam. I told you I have a gun over here. I'll shoot. Okay. So what is the cheapest exercise you can be doing with your grandchildren for your nose hygiene, for your lungs hygiene? Newcomers, think. Manjusha madam.
Mental hygiene also.
Huh? Nikki
Mental
Masalia.
also you feel relaxed.
Not allowed, Nikki Masalia. Nirupama Sharma, do you think you know any exercise which can be done for improving the lung vital capacity? Madhura Kolgot can answer. Think.
Breathing exercises one can do.
They are boring, madam. They are boring.
Anulom Vilom.
Sit
So
ups.
grandchild.
Anulom Vilom.
What if your grandchild
Like
comes
a-
home?
Like a dog with a tongue out.
Tongue out. Okay. What else? Singing, Mini Gogia sing. Somebody else mentioned pranayams. A game. Cookie comes. Senior students answer.
Hugging.
Huh?
Hugging your grandchild.
Array, for lungs, how will your lungs improve with hugging?
Lungs.
Nikki. Yes, Nirupama Sharma.
I only think of deep breathing. Deep breathing.
Is that a game? Is that a game?
No, no, it's not a game.
Okay, Lakshmi madam wants to answer. Yes, Lakshmi.
Okay. Tickle them, make them laugh.
What else?
Balloon, blowing the balloon.
Yes, Radha.
Yeah, oh, yes.
Take not the holy balloons. The child will leave it in 2, 3 balloons blowing. He gets frustrated. Take good, good quality, bigger balloons. Okay, and ask them to blow, and you also blow. That uses the alveoli, which you've not used.
Yes.
Now we use only 2/3, the middle 1/3 of the lungs to breathe. Other areas we don't use only because we don't know how to use.
Earlier days we used to have the air pillows, blowing pillows.
Now, who is using air
Blowing
pillows?
candles.
Nowadays, no one is
Now, who
using
is
air.
pillows? You will use it only when you're traveling.
Traveling.
Blowing candles also.
How many candles will you blow?
There's
Nikki?
a
also can help.
Again you will
hospital.
blow. Again you light the candle and again you will blow. Thak jaoge.
Ma'am, in the villages when they are doing cooking, they do like this to light the fire.
Will
That's also-
whistling help?
Yeah.
We live in a village. What do we do? So it will go on increasing the lung capacity. Huh? Followed, Nikki. Once only you will blow and it's over. We need to inflate the balloon more and more, more and more, more and more. Then you will tap and you will release that dead space air between your lungs.
They have to make us do for the asthma also.
We spoke, no, a lot we spoke in asthma class. That's why I kept them together. Respiratory, both the things I kept together, back to back. Last week we had on asthma. Before that we had on diabetes. So the child's immunity will definitely increase if you do these games. Okay. Frequent colds. Now, let us understand what exactly are nasal polyps. So, nasal polyps are similar to the mucous membrane only. See, now there are two types in this. Now, these are just like polyps and these have a peduncle. What is the meaning of a peduncle? It means a stalk, a small branch kind of a thing, and then they are hanging down. These are coming out. These are known as turbinates. Huh? Superior turbinate, middle turbinate, and then there is an inferior turbinate in the nose. What is the meaning of a turbinate? The whole skin is in a kind of a protrusion or a kind of a groove below that. So this is the way the polyps keep coming down, and they cause a lot of irritation, they cause a lot of cold in the person. Yes, this we finished. So what are some of the home remedies to relieve sinus symptoms? So first is salt water nasal irrigation. Adults can be doing, you can't be doing that for children. Use steam vaporizer or humidifier. Apply warm compresses to the face. Drink a lot of fluids, because remember, when you drink, you will push that histamine out from your body. Hot shower to relieve the pain, promote drainage, and open up the sinus cavities. See, she's having a hot shower, head shower, because they will open up the drainages and or promote drainage and open up the sinuses and get plenty of rest. So this is the way Jal Niti is done with the pot. Yesterday we discussed that it's not a great idea to be using the Jal Niti pot, but you should be learning how to do it with your palm. So this is something which is known as, I'm going to be self-reliant. Even if I'm flying and I forget the Jal Niti pot, I can use my palm anywhere, anywhere. We just need a little bit of warm water, tap water not to be used. Why? Salt we discussed. Why? Why not water?
Contagious, maybe.
Contagious? No.
Chillness.
Hmm? Why should we?
Temperature, we use a little warm water. The tap water is not warm.
That's what I'm asking. Why do you use warm water?
Body temperature.
So that if there is inflammation and things like that and mucus
To
thick,
loosen
it will
the
loosen up.
Because all your body discharges are warm. So you are trying to become friendly to your body. You are mimicking the existing body discharges by heating that. Okay, what happens when you swim? The pools are not heated, no? When you dive, what happens? Something happens to your nose for 5 seconds and then you get normal. What hits you? Right? So when you are introducing warm and salt water, you are mimicking your existing body discharges. So it does not come as a what happens when you swim and water goes in the nose?
As a shock, ma'am.
Shock, as a jhatka. Followed? So this is the way it's done. Mix 1 teaspoon of sea salt and half, no, I don't allow hydrogen peroxide. I just say take a warm water, and this is using the bulb and the syringe or other irrigated. Do it for a few days until you get relief. So remember one thing, never ever do this nasal irrigation. What are the names we spoke yesterday? Nasal irrigation, nasal toilet, nasal douche, Jal Niti. Never ever do it when you have the attack. Okay, your sinuses are patent and open. You will introduce more infection, and then you'll say all these techniques are humbug, they don't work. But you won't take your mistake. What did you do? So in the clear periods, what do you mean by clear periods?
When
When
you are not in
that time you should,
active
by
form of the disease.
sinusitis.
so that you don't get the attack of sinusitis.
Preventive method.
Correct. And you will get a glow on your face. People will tell you, have you done a facial? How you're looking so good? Have you done a facial? Just give me a minute. Just give me a minute. Just give me a minute. Sorry about this. Okay, what can be the medical treatments? There are decongestants for acute sinusitis. Chronic sinusitis is a little difficult to treat. Medications include antibiotic decongestants, mucus thinning medications, antihistamines or anti-inflammatory, corticosteroid nasal sprays, oral corticosteroids. Now, these nasal sprays, they are very addicting because in a jiffy they reduce the inflammation and you get clear nostrils. So somewhere I had heard or read that Mr. Shah Rukh Khan is hooked on to that. So you can imagine so much of relief comes that you get dependent on it. Not a good idea. That's why I give you some simple remedies of just using saline water drops, a little warmth to so that the body does not get that shock kind of a thing. Then what else can you do? How do you think you can be doing surgery? How do you think surgery can be helping you? If there is a physical abnormality, that is a nasal polyps, small great red growths, crookedness in the wall dividing, that is the deviated septum, crookedness in the wall dividing the nostrils, removing the adenoid tissue, the lymphoid tissue which keeps getting inflamed. Okay, or procedure of antral washout. This is again a surgeon's this thing. Sinus puncture, as the name is telling you, they puncture the sinus to drain it, and operation of deviated septum to make it straight. Two devices, they make it straight. What is fungal sinusitis? Prevents damage. Again, surgery can be used for fungal sinusitis also to prevent damage to the sinuses, eyes, or brain. Now, is a sinus contagious? Okay, so what is sinus? Tina, can you, Anurag, can you just look into this sound? Also called sinusitis, infections. Yeah, this we learned, mucus or bacteria. So, what is the main aim of these sinuses? Can anybody think? This? Okay, so one is they improve the tone of your voice. The second is it makes your skull light. Imagine if the sinuses also were full, your skull would get very heavy. Hmm? And sinuses produce mucus to keep the nose and the sinuses wet. They have a mucous membrane to produce mucus. Yes, this we learned. Now, usually the bottom line, are they contagious? So usually not. However, many conditions that lead to sinus infections like cold, flu, respiratory viruses, etc. are contagious, especially among children. To prevent infections, you must take steps to prevent respiratory viruses. So what is the summary? So sinusitis is an inflammation of the paranasal sinuses. The medical name is rhinosinusitis, rhino meaning nose, because it affects the mucous membranes lining both the nose and the sinuses. And the paranasal sinuses are part of the upper airways and are connected to the nasal cavity. Sinuses, what do? They lighten the skull or improve your voice, and their main function is to produce a mucus that moisturizes the inside of the nose. So I have part 2 also. Let me quickly see if I can share a few more slides about deviated nasal septum and this thing. Just give me a minute. I'll show you some, picture memories really work well. Yeah. So this is something, let's just skip. One slide I want to show you all. It's all a repeat only. It's a repeat. I'm sorry. I put all in one. Any quick question? We have a minute more. 2 minutes more. Learned a lot? Okay, thank you.
Ma'am,
Sinusitis
pain
will.
on eyebrows.
Pain on eyebrows. Which sinus is affected? Tell me. Frontal. So what we can
Frontal.
do? You can apply warm fermentation here, and in the clear periods, massage that area. Apply acupressure points like this. Massage those areas. Okay. It is not at your eyebrow. It is below your eyebrow. This area. This area you should be applying pressure as much as you can take. Don't apply too much pressure. And massage this area. Massage this area. See, the sinuses are there. This area also you can be massaging a little low. And then this. In the face yoga, I teach all know all these exercises. Remember?
Yes.
Maria, you had it now. Since you climb the stairs. No.
No.
Yesterday you had gas. Today you don't have gas.
Yeah,
Maria,
I have difficulty walking steps without support. I have to hold the bands here.
hold the stair, hold the railing, but climb up the stairs. 2
Uh-huh.
floors each day. Maria, very wrong.
Uh,
And you came for my class
yes,
without doing the
doctor.
homework.
Yeah.
You don't
Yeah, I
remember
have to do it.
you?
Okay, doctor, I have a question. In the morning when I get up, I have like phlegm at the base of my throat and like a pulling from the top of from my nose. So, and it's normally black. So, is it some sort of discharge?
Maria, I will not be able to decide because I don't know your case. Now,
Yeah.
means an old bleed. I don't know your case. So, how can I decide and advise you?
Yeah, exactly. Exactly. Anyway, I will try this native
Something in
maybe.
general I can advise, but an individual case, unless I take the whole case, I cannot understand you.
I need to come and see you, doctor. When can I come? We are so close.
You all are frozen. Yes.
I'm the closest, I think.
Yes. Okay.
Yeah.
So thank you for the gift of your time, energy, and attention. Thank you, Anurag. And we meet on Friday morning for a yoga class, 9 a.m. I think it's again restorative yoga. You can hop on to that 9 a.m. class. Bye bye.
Thank you, ma'am.
Thank you,
Thank
doctor.
you. Thanks a lot.
Bye
Take
bye.
care.
Thank you.
See you.